Hi friends, good morning. So, how are you? So, in this session, I would like to talk only about ACL. So, many people commonly ask me, Sir, is surgery compulsory for ACL tear? I ask you, do you have any instability? Do you have any difficulty in bending knee? Do you have any difficulty climbing stairs, running, jumping, jogging? Because daily at least I get 5 to 10 MRIs, at least minimum 10 MRIs of the ACL tears from different parts of the country, sometimes from other countries also. So it's very important to know what is the main problem for the patient. So do you have any instability? Do you have any difficulty in walking? Do you have any difficulty in running, jumping, jogging? These things we need to see. Okay. And how old is the injury? These things. So whenever you have instability, whenever you have difficulty in walking, running, and all, then we advise surgery. We advise surgery. That is arthroscopic ACL reconstruction. Okay. So next common doubt will be, sir, from where you will take the graft. So we take the graft from either peroneus longus or semi-T, semi-tendinosus. Usually I take ST graft, semi-T graft, semi-tendinosus graft in most of the patients. If I feel like the graft needs, I mean the graft diameter needs to be more and all, then I choose peroneus longus. Okay. Then the next doubt will be, sir, can I go back to the sports? So I tell it will take 8 to 9 months to go back to sports. See, one of my patients, he went to Sabarimala just 4 months after the surgery. So it doesn't mean that everyone will have the same, uh, will get the same result. It also depends like your muscle power and all. Okay. So by and large, I tell it will take at least 8 9 months to go back to sports. See, if you are doing work from home, if you are a software engineer, so you can do from the next day itself. Because ACL surgery, you can just sit and do your computer work. Okay, it will not hamper your, I mean, doing the computer job. See, if you are doing a marketing job or you have to drive a bike daily, then you have to be at rest for at least 1 month because you cannot drive. I suggest not to drive the bike for at least 6 months because if you again have any history of trauma or any twist injury, the chances of tear will be very higher. So I advise to sit at the back seat, then go to the office with someone's help. So many patients ask, sir, will there be any complications? So there will not be many major complications with ACL surgery because it's a very routinely done procedure. Having said that, sometimes, very rarely, there can be infection, post-operative knee stiffness, sometimes a graft failure. These things can be there. DVT, deep vein thrombosis. These things can be there. Okay. So how we do? So we do arthroscopically. Basically, we put two portals into the knee joint. We put two portals into the knee joint. One is anteromedial portal, one is anterolateral portal. Anterolateral portal is the viewing portal. Anteromedial portal is the working portal. So that is how we do the surgery. It is done with a very small incision. It is not. It will not take big incision. So in the comment, someone asked, "Sir, I have recurrent shoulder dislocation. I need to consult with you." Friends, in the morning hours, I am there at the Pulse Heart Hospital, Miapur, Hyderabad. In the evening, I have clinic at here only in the IDPL. It's 10 minutes journey from the Balnagar signal in the Chintal IDPL area. Okay, I will put my WhatsApp number, but majority of the times I will reply as early as possible. So you can message me in the WhatsApp. Okay, if you have any doubts, please ask. Regarding the ACL surgery, if you have any doubts, please ask. From now, I'm thinking to do live 10 minutes live surgeries. Sorry, 10 minutes live YouTube lives to interact with you all, because I'm based at Hyderabad. Most of the patients who come to me are from the Telugu states. So majority of my videos are in Telugu only. So I'm trying to make some videos in English or Hindi. So regarding ACL surgery, I told graft what we will take, when you will go back to sports, when you have to come to the hospital. First dressing we do the next day or after 2 days. Then I come to see the patients after 1 week from the date of surgery, and from the date of surgery, 15 days after the surgery, I do the suture removal. So usually you need to come only twice. Then after every month once visit. For first 5 months, that is enough. So multi-ligament tears I am getting more nowadays. ACL plus MCL, what to do? Friends, we need to examine the patient first of all, because majority of the times MCL will not need surgery. So we have to see whether it's a complete tear or a partial tear. Okay. Uh, so we do very routinely ACL plus MCL. We do very routinely. So monthly at least 2 ligaments I operate. So if MCL needs fixation, we do fixation. If it requires reconstruction, then we take the graft, and the femur side we use either button or a screw. The tibia side we use either a button or a screw. So if you have any other doubts on ACL, please ask. So there are many people watching, but no one is asking any doubts. So some of the patients are sending their reports with a failed ACL. So failed ACL or revision ACL, we need to examine the patient, number one. Number two, we need to see the tunnel diameters. We have to get a CT scan done. Okay, just by seeing the WhatsApp reports, reports, MRI reports in the WhatsApp, we cannot tell the further management protocol, because if the defect is large, we need to be prepared for the graft also. Okay, so sir, I have a doubt. My name is Nikhil. I have multiple shoulder dislocations in the past. Because of that, I consulted a doctor in my hometown. He suggested an MRI scan. Okay, so that's what, sir, I am talking. Shoulder, definitely I'll make another video. But regarding your doubt, see, whenever there are multiple shoulder dislocations, the chances of glenoid bone loss will be more. So we need to get a MRI first. Number one is the MRI, because we need to see how is the Bankards, how is the Hill Sachs, is there any bony Bankards and all. To measure the glenoid bone loss exactly, we need to get a CT scan. Naveen Garu, can you help us in understanding, is there any drinking water and osteoarthritis? Sir, to be very honest, I can tell you one thing. In my childhood, I was in Markapur. It's a very small area, remote area in the Prakasam district. It is near to the Ongol. There are no water purifiers. There are no water purifiers there. Water also, getting water is very difficulty there. We have to go to remote areas and get the water. Or boring pumps కి వెళ్ళి బోర్ కొట్టాల్సి వచ్చేది. చాలా ఇబ్బంది అయ్యేది. I came from that place. I've seen how difficult it is to find water. Okay, in Hyderabad we are having RO system and all, but there are many studies which tell the more purified it is, we are not getting enough minerals. Okay, that is there. That is what I can tell. But I don't know exactly if you take RO water, you will get osteoarthritis. I don't know that part. But if you are water, if you have the MRI report, please send to my WhatsApp number. I'll see that. If possible, come once. If you are not able to, I mean, I cannot tell like that, but if someone is not able to pay the fee, no problem. They can message and come directly, because I prefer to see the patient rather than seeing the patient's MRI reports and suggesting the treatment protocol, because I am just a message away. I am there in the Miapur Pulse Hospital, so you can come there. If that person is not able to pay the fee, consultation fee, no problem. I can see, I can examine, I can give my opinion. Okay, if you have any doubts, please message. Thank you. Bye.